So it is my pleasure to introduce you to your two presenters for today. Kim is a registered nurse and has been since 2007. She has experience working with the perinatal program and has shared her passion and knowledge with many students in her role as a part-time teacher at the University of Ottawa. And since 2012, she has been working as an advanced practice nurse with the professional practice team at the Montfort Hospital and is co-lead of the BPSO steering committee. She recently accepted a new leadership role as the new professional practice and clinical informatics manager. She's passionate about best practices, e-health, and the impact nursing can have on patient outcomes. And then we also have Marie-Josée, and she has been a registered nurse since 2010. She has experience working both as a staff nurse providing mental health care and as a lecturer, theoretical teacher, and a clinical supervisor who specializes in mental health and gerontology. She joined the Montfort Hospital in March 2019 as a clinical nurse educator assigned to the mental health program. She supports the clinical and leadership teams in the implementation of a francophone therapeutic milieu and services focused on recovery. So for those of you who are not familiar with BPSO, when I say that, it actually stands for Best Practice Spotlight Organization. And just to let you know, it's one of the programs that RNAO has in which we work formally with health service as well as academic organizations to implement as well as evaluate the implementation of best practice guidelines. So it is quite a dynamic partnership and it focuses on making a positive impact both on patient care using evidence-based practice. And so now that I've introduced your speakers for today, I'm going to pass it on to them.
Good afternoon, everybody. I'm Marie-Josée speaking, and I just want to say a few words before we start. Being very passionate about suicide prevention, I'll just say a few words, as we would say in any presentations, any discussion about suicide prevention. We sure know that suicide prevention can be a bit of a heavy topic, so we want to make sure everybody's feeling okay. And that if you're not, and if you need help, that you can talk to someone or call your local crisis line. If we were in class, we would keep an eye on you, but since I can't see you, I just want to say these few words. So for our learning objectives, I'll let Kim say a few words.
Hi, everybody. So today I get to do a few slides, and then I have the pleasure of letting Marie-Josée present most of her work. So today for the learning objectives, we're going to gain a better understanding of our planning activities and why we chose specific platforms to leverage RNAO's risk for suicidal ideation and behavior, BPG. We're also going to share with you our successes and challenges regarding our first Suicide Prevention Week. And we're hopefully going to gain a better understanding of how to intelligently use BPSO's champions events and activities to reignite the engagement of the frontline healthcare workers to achieve best practices. So first and foremost, I'm going to present to you our fabulous hospital. So Hôpital Montfort is Ontario's one and only Francophone academic hospital. We are located in Ottawa, Ontario. We serve over 1.2 million people in Eastern Ontario in both official languages. You could probably tell by our accents. We house over 1,800 employees and over 300 physicians in our 289 acute bed hospital. In 2012, Montfort was designated with the Best Practice Spotlight Organization by the RNAO and have been continuing on this journey ever since. In 2019, we embarked on two new journeys with RNAO, one of becoming a first Francophone host for BPSO for best Practice Spotlight organization, and the other as a BPSO OHT, which is another acronym for the Ontario Health Team. So like I sort of mentioned before, I'm thrilled to say that from now on, you won't be hearing much from me, but from my fabulous colleague, Marie-Josée. She put her heart into this initiative, and I'm so proud of her. And I want her to have all the time in the world to present her great work. So Marie-Josée, I turn it off to you.
Thank you, Kim. I just want to say that maybe I'll be the one speaking today, but without a wonderful team, we can't do we can't go forward with such initiatives. So thank you to you. So let's start with let's start by talking a little bit about champion recruitment strategies. You can, as you probably know, suicide prevention is not necessarily the easiest topic. It's not necessarily something people want to talk about, and maybe they're not feeling concerned. Maybe they feel it's taboo. There's a whole lot of myths. But as you'll learn throughout the presentation, we did that first Suicide Prevention Week without actually realizing that it was a champion recruitment strategy. So I'll talk about that a little bit more as we go. So how did we, or what were our strategies to reignite champion engagement? With that, as first Suicide Prevention Week, of course, we wanted to raise awareness. Let's just talk about the subject. And of course, change perceptions. If we talk about it, if we give a voice to people with a lived experience, it helps change perceptions. And of course, we want to promote caring from the healthcare professionals, people working out in healthcare for a reason. And if we show them a little bit more about suicide prevention, maybe they can care a little bit more. So let's just go straight to what was our first Suicide Prevention Week. And what we did during that week, and then we'll speak a bit more about all the preparation and all the communication strategies we used to promote that week, because there was the week itself, but then there was a whole lot of work around that. So our first Suicide Prevention Week took place during Quebec's Suicide Prevention Week, as we are in Ottawa, close to Gatineau. A lot of people at the Montfort also live on the Quebec side, so it felt right to do it at the same time. During that week, we had 3 conferences during lunch hour. So the first one, Breaking Silence, was a panel with 4 participants and 1 moderator. We had 1 employee from the hospital on the panel as a person with a lived experience. We had a patient partner who lost his father to suicide. We also had someone from the community who lost her husband to suicide. And then we had someone from the mobile crisis team. So we wanted to just give these people a voice to explain, to share what was their experience. And we also discussed how to improve services, because sometimes services are hard to access. Sometimes it doesn't always feel right. So we wanted to discuss that. The second, so that was on the Monday. On the Wednesday, our next conference was from a comedian. Michel Mambara is a comedian from Montreal. So he is a person with a lived experience also, and we wanted to actually just have a little bit of fun to start with, because he's very interesting, he's very fun, and also to kind of show people that, well, you can still have a career even if you were hospitalized as an inpatient with mental health problems, even if you had suicidal thoughts at some point. You can still have a career, still be involved in your community. And of course, it was great to have Mr. Mbara, since our employees are very diverse in terms of culture. It was great to have someone from a cultural community. And our last conference was from Indigenous elders. It's a couple who sadly lost their son to suicide when he was a teenager. So even, I think, 40 years later, it was still a very strong message that they had to share. It was very touching. So they explained how it changed their life, how they are engaged in their community, how we can better understand their community. So this was also a great conference. And as you can see, we had quite the attendance for these conference. It was quite amazing how many people showed up. But before we got to that to that week, that was, I don't think I said it, was the first week of February 2020. Before anything else, of course, preparation is the key to success. We had a lot of planning before so that we could make sure people would actually come to the conferences. So let's see a little bit what we did in our communication strategies. So prior to the Suicide Prevention Week, we had to find volunteers. As I said, for that first conference, we had someone who wanted to share her own experience, an employee from the Montfort who had the courage to come on stage and explain what was her experience. So we actually sent an email to all employees to ask if anybody had either a lived experience, personal or professional, who would like to share that. We had quite, we didn't know what to expect, just sending that message, but we actually had quite a few people answering that message, and we had little conversations with them. Of course, we know it can be quite sensitive, and we wanted to make sure these people were ready to talk about it publicly, and that they were okay with that. So that was one thing. Of course, we had posters plastered all over the hospital quite early in January, as soon as we could make sure our conferences would go through. And probably the biggest thing we did was 1 week before the conference, I'm sorry I didn't explain, I was not alone in planning all of that. I had a colleague at that point who's sadly went on to different projects, but there were the two of us planning that. So the two of us went and met 23 actually teams throughout the hospital during their quality huddles. So a quality huddle is happening 1 to 5 times a week. It's all the people from a team, say HR or one specific inpatient unit will meet. It's a standing meeting, and people can discuss whatever's going on in their services, and they can hear news, discuss whatever needs to be discussed. So during the quality huddles, we actually went and met people, and we gave them a little card. First, we card and a sticker, actually. On that card, I know it's written in French, I'll translate in a minute. we wanted to not only let people know that we were having a Suicide Prevention Week, but we also wanted to kind of plant a little seed and talk about suicide prevention. And we very quickly, what we explained is that when someone has suicidal thoughts, there's usually two parts of that person. There's the part of the person that wants to die, but there's always also a part of the person who wants to live. So of course we want to acknowledge the suffering, acknowledge that part who wants to die, but we don't want to just do that. Because if I'm asking you to explain to me what are all your problems, what's wrong, what's making you sad, well, you'll probably just stay sad, and I'll feel bad to just leave you that way. So we're trying to find that little thread and to have the part who wants to live to grow, to make that part grow. So one strategy we have with patients is to discuss topics that make the person feel good just for that moment. It's a kind of a mindfulness thing. So the type of questions we asked people during the quality huddle was, what do you love to do? Explain to me what do you love to do? And lately, what was your biggest accomplishment? And another one was, how would you describe yourself in just one sentence? So we actually gave the card to people and pointed to people, just like, okay, on this spot, tell me what for you, what do you love to do? So people it kind of opened their mind, and we had some pretty amazing discussions with people at that point. The other side of the card was the actual schedule for the conference. So we left them with that little card, and we also took a picture of their teams and gave them a little sticker that I can still see. I don't know what, 8 months later, I can still see people wearing that sticker on their card. So, and these photos were used on our social media. I'll explain a bit later. So that was it for the quality huddles. During the Suicide Prevention Week, we had daily posts on social media using, of course, our hashtag and all these photos we took, and of course always giving the crisis line numbers and things like that. We had some daily messages using Montfort's communication portal for all employees, and we had some videos that we did in collaboration with our Research and Education Institute. So I'll just give control to back to you so that we can watch the videos.
When I finally heard that he did take his life, it was a shock. I also felt remorse for not having taken him more seriously. People don't usually talk about tricky things or taboo subjects unless they actually are looking for help and there might be something more serious going on. If someone were to approach me and said that they were experiencing suicidal thoughts, I would tell them that the thoughts that they're having are not necessarily something that you should consider to be weird, but more so something that you should do something about. So rather than shame yourself for feeling sad and avoiding what it is that you're going through, you should accept it, that you are experiencing something dark, and look for help.
C'est une chose que je voudrais qu'on garde en tête, la prévention du suicide, c'est un travail quotidien. De prendre les gens au sérieux parce qu'il y a des choses qu'on peut faire. Jamais les ignorer. Si j'avais un message, c'est nous faire confiance, de nous de nous parler, d'être honnête avec nous autres, de vous aider à passer à travers ce moment-là. Vous avez toute une super belle équipe qui est là pour vous aider, qui ont plein d'outils pour vous redonner l'espoir.
Confronté à une situation où quelqu'un me disait qu'il voulait activement se suicider, il a fallu que je me mette en avant de cette personne-là pour l'empêcher de faire ce qu'il avait en tête. Je veux dire, c'est juste de savoir à personne que toi, tu es là, tu réponds à ses questions, tu parles avec elle juste pour le savoir que s'il y a quelqu'un qui se soucie d'elle, c'est toi en ce moment. C'est pas quelque chose qui est facile parce que veut pas, à l'extérieur, on va parler de ça. Puis ça va être un sujet qui est tabou, même si ça devrait pas nécessairement être un sujet tabou. Comme j'ai dit, la première chose à faire, c'est d'en parler. Mais les gens, ils ont peur d'en parler à cause de la réaction des autres. Mais c'est vraiment juste de pas oublier que c'est une vraie crise, puis que c'est vrai, puis que cette personne-là passe vraiment à travers quelque chose, puis c'est pas juste une personne parmi tant d'autres.
All right, while we go back to the slides, I have to confess I'm still a bit moved. I still get emotional when I'm watching these videos, even if I probably have 200 views on each of them, since we did the actual shooting and work with the person who actually made the final product for these videos. So think I have control back, but we're not back on the slides. So the making of these videos, there's actually 5 of them. There was one with myself and my colleague just explaining what the week was, that was just shared in-house. And then there was another one with 2 of our psychiatrists from the inpatient unit, explaining how let's say it's hard for psychiatrists that that you will likely lose someone to suicide at some point or another, but that you're never really ready for that. So we're still on YouTube. I don't know if I'm supposed to do something to go back to the slides.
Okay. Oh.
All right. Okay. So just a few last words about the videos. The first one you saw, Peter, is actually the guy who was filming the videos. It wasn't planned for him to do a video. He just, as we were discussing while we were shooting for other people, he just said that he also had a story, and we begged for him to make a video in it. It's a very moving one. Then Chantal is one of the managers for the mental health inpatient unit, and Julien, of course, is one of our security guys. So if we go to successes during that, well, the whole process of that first suicide prevention week. First thing I would say, the participation to the conferences, we were thrilled, honestly, up to 100 people per day. for the conferences. It was great. People really showed up, not just from mental health, people from all services, healthcare professionals or administrative personnel or doctors, or a lot of people showed up. And then, of course, the quality huddles were amazing. People still talk about those little cards. People would still point to me and be like, "Oh yeah, I need to say positive things." So I think we had an impact with these. We also had, I didn't say before, we had patients participating to the conferences. We had inpatients, actually, people from the unit we brought to see the conferences, and we had one of our the social worker, I can't remember, one person from outpatient who did an amazing job to invite the people, the patients they see in the outpatient clinic. So we had quite a few patients. It was very important for us to include patients in that week. Another thing that was amazing is the collaboration with different services, with different partners. Also, communication was a big part of that first week. The foundation was the one who found some money for us to be able to do that. Our Research and Education Institute provided someone to do the videos. So lots of collaboration and partners. The mobile crisis team sent someone. And finally, the positive feedback we had. I feel like if I'll talk about it a little later, but yeah, let's say it for now. Let's go to a couple of challenges though. Planning such an event is very time consuming, and we had limited human and financial resources, and maybe we lacked a little bit of experience in event planning. So it took a lot of time and energy. I would say it's absolutely worth it, but it was yes, a bit challenging at times, and I would say that we have many lessons learned about that. One thing we learned, and it has to do with reigniting champion engagement. If you go see people, if you go meet them on their unit or in their office, they will take time to listen to you and to have a conversation with you. So when you have more of a difficult topic, just going to talk to people will raise awareness. We didn't realize it at that point, but we were doing a Gemba walk. Other lesson learned: start preparation early. There's a lot of things that we kind of did last minute, and now I know I would not be doing it the same thing this year. Involve all services, not only clinical personnel, and all employees need to be aware. And then preparation is not only the key, but it's part of the event. And so that's probably our biggest lesson that we learned. And we realize, and I'll finish on that note, that we did many good things, but we didn't realize that we were doing it while we were doing it. And maybe our goal for that Suicide Prevention Week was more to raise awareness and to change perceptions and to promote caring, and not necessarily try to find champions for our best practice guideline. But in the end, I feel like we did. I feel like we were not necessarily looking for champions, but by raising awareness, changing perceptions, and promoting caring, we ended up with a huge pool of potential champions and super connectors. So go and ask someone to be a champion, they'll likely say no. Make them care about what you want to talk about what you want them involved with, and they'll likely say yes. So I know that right now, well, maybe with COVID, it's not the perfect time to go and find some new champions. But if I was to go and ask people, I know the people who came to all 3 conferences that will likely say, yes, I want to be engaged, I want to be involved in your next suicide prevention week or your next event or whatever we're doing in suicide prevention. So last thing I would say is not only healthcare professionals are now feeling engaged in suicide prevention. I feel like all employees and management and upper management feel, I think we made people care. That is what I want to say, and I'm very, very proud of that. And it was huge teamwork. So that's it. I think I went a little over. I hope you have a couple of questions.
Thank you so much, Kim and Marie-Josée, for that excellent presentation, for your use of creativity, for helping to destigmatize suicide, and for putting a face to it with your videos and the personal stories that were shared, both from healthcare professionals as well as patients. So if anyone has any questions for them, please feel free to share, or if you want to raise your hand, we can definitely unmute you. Perhaps while you're thinking about that, I do have a few questions for the both of you, if you don't mind.
Of course.
Okay, so you said you had patients participate in a series of conferences, and given the nature of the topic, it's very emotional, can be triggering. How did you ensure that the patients were okay during their presentations?
That's a good question. A lot of people were worried about bringing patients to the conference, but it was not our first experience doing that. The first time we did it was for other conferences, and we felt that it was so important for us to bring them, but to bring them with someone, let's say, to make sure they were not just thrown in, and so they were of course accompanied by someone from the unit for the inpatient and then with someone from the outpatient services for the outpatient. And sorry.
Okay.
No, okay, no, so I'm just receiving, I thought I shut down all my notifications, but I'm receiving notifications, so it, I don't know how I did that. Okay. Sorry. So yes, making sure patients were okay was done by, of course, having people surrounding them and always keeping an eye on them. And as I said in my little intro, my little before we start intro, when we're doing suicide prevention events and presentations, conferences, we always have kind of people who are the spotters. If we see someone who's kind of storming out or something, we'll usually follow them and go and make sure that they're okay, because we know it can be quite difficult.
Yes. Okay, well, a lot of like sort of safety measures and ensuring that individuals are okay, is what it sounds like. Okay, excellent. Thank you. We do have some other questions coming in. One, how is suicide and COVID-19? Has it increased?
We unfortunately know that during economic crisis, people tend to have more suicidal thoughts. And we see it on our inpatient unit. We did see an increase, and I'm reading articles about that. We know that people tend to be a bit more shaky during such crisis. So I think it's very important for all healthcare professionals to kind of keep an eye, because we've seen also people with suicidal thoughts, not in mental health, let's say on a surgical floor, or just to keep an eye, because yes, we see in history when there are some crises like that, people tend to have more suicidal thoughts.
Okay.
And if I can add a little bit to Marie-José's response.
Yes.
Knowing all of that, the committee committed themselves to trying to create a resource base where all MOFOT personnel could go and reference if they themselves were having suicidal thoughts, or a friend, so we really tried to be out there as much as possible. The suicide prevention committee is like up to par on all the articles. They know so much. So they really try to share that knowledge with patients, with staff, and they created a nice resource base where it'll be accessible for everybody to go and learn about suicide prevention and risk assessments.
Yeah, good point, Kim. And we're also in the process of making suicide prevention training available for all employees at some point. And we're following the zero suicide model, and of course it's baby steps. We can't do everything in the same year, but we're really proactive with that.
Okay, excellent. Excellent. So there's, resources, and then a longer term plan in terms of building capacity and addressing suicide beyond the weeks of awareness.
Yes, of course.
Excellent. There's other questions that are coming in. Christina is asking, while mental illness and suicide prevention is an important health concern worth raising awareness, was there any other reason this week was initiated?
I think
Partly is our BPG. It is one of our main BPG that we have implemented at the Montfort Hospital. So we really try to make them shine. We've implemented 10 of them. So we try to make them shine at different moments, but this was definitely an opportunity to revamp and reignite a BPG that was maybe needing a little bit of TLC. So.
Okay.
I think we're just at the Suicide Prevention Committee, we're just very, very, very passionate about that subject. And I think we were just a little bit jealous about the Quebec side who had their Suicide Prevention Week, so we wanted ours too.
Okay, so a little bit of friendly competition there.
Exactly.
Okay, excellent. Another question, what was the reaction or response from non-mental health clinicians to talking about suicide? Was there a big challenge with stigma?
That's a very, very good question. Suicide Prevention Week was not our first intervention, if we can say, with people who do not work in mental health, or people who are not clinicians, for all employees. So we did back in September last year, the World Suicide Prevention Day. And one of our activity was actually to discuss myths surrounding suicide. So we had some very interesting conversations with a whole lot of people. We had a booth near the cafeteria, and we just asked people to okay, well, pick a question and tell me, is it a myth? Is it true, or is it false? And we saw what people were thinking, and we continued on that. So we've been building on that for a little bit, to try to to discuss it, to see what people think, and there's no wrong answer, and we can just give more information.
Okay, excellent. So it sounds like there was an opportunity to have the conversation out loud and to create a safe space to be able to share without judgment. So
and during that Suicide Prevention Week, we didn't have any incidents or any people asking odd questions or anything. People were very, very respectful, and we're very open. Actually, wanted more. Like, feed us. we want to learn, want to understand. And I think showcasing people with lived experience was very, very important for that. I think that's probably what works best to with stigma.
Exactly. I found the videos very compelling as well, so I can definitely relate to that.
Right.
Excellent. Erica's asking, do you screen all patients for suicidal ideation as part of patient history?
All patients presenting with mental health issues, yes. All patients, no.
Okay.
Or I would say, well, all patients presenting with mental health issues or something comes up. Like if you come and emerge with a broken leg and it's really like a ski accident and no mental health history, no nothing, no emerge, they won't screen everybody. That's been a heated discussion actually at the mental health committee, because their suicide model promotes that we should screen everybody. So we're still, for now we don't. We're still in the process of making a decision on that.
Okay, so universal screening versus, if you're at risk type of screening.
Yeah.
Okay. Okay, thank you. And there is a final question here. You mentioned the inclusion of Indigenous elders. Any other Indigenous specific initiatives or strategies?
Yes, actually, maybe Kim, you can help me a bit on that one, but I can't remember. I think it was last winter. All the people involved in leadership at the Montfort received a day-long training session from Wabano to help us make better decisions, just to learn, to understand better, to make better decisions, to provide safer care for Indigenous people. So, and I know we're now able to do smudging in the hospital at the beginning of that conference. During the suicide prevention week, we did smudge the room before the two elders spoke. So I know there's a lot going on. We have a lot of partnership with Wabano.
Okay, excellent. And a final question from Mary. Would you do anything differently if you were to present this initiative to an audience specifically composed of students?
This presentation or the Suicide Prevention Week?
Mary, would you be able to clarify? It seems like this initiative, so it may be the Suicide Prevention Week.
Just for student, for the Suicide Prevention Week, well, that's actually a good idea for next one. The Suicide Prevention Week, that's actually a very good idea. I'll put that in my pocket for the next one. That we could have actually sessions specific for students, and as you said at the beginning, the most of my career I've been an educator, so it's speaking to me. If I would do something differently, well, maybe a little bit more, maybe covering the basics, giving a little bit more information, maybe, yes, giving some little quick training sessions, and I would love to do that actually. We'll see if my manager wants me to do more more training sessions or not.
You know I support you in everything that you do.
There you go.
Well, Marianne, you'd be interested in following that initiative and helping out. Well, reach out. You have my phone number and my email address right there. Reach out. I'll be happy.
Well, there you go, Marianne, because she says she's interested in following that initiative and helping out, especially she's a student herself.
Well,
so
I'm waiting for your email.
There you go. Okay, so it's about time. Again, thank you very much, Marie-Josée and Kim, for your presentation. Learned a lot from your Suicide Prevention Week in terms of strategies and lessons learned. And it looks like you've come away with probably another initiative idea. There is a final question here before I wrap up. Are you connected with Zero Suicide Model?
Yes, I was answering in the chat. Yes, we follow the zero suicide model. We're moving forward, trying to do better. The zero suicide model has very, 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 very high standards, and we're aiming for a 5-on-5. I don't know if I'm allowed to share our number for now, so I won't. But we're doing, I think we're doing great, and we're improving year after year on that.
Okay, well, there you go, Katie. Well, thank you very much, everyone, to the presenters as well as to the audience for attending today's Champion Information Sharing webinar. Of course, today's presentation is going to be posted. The slides will be posted with permission from the presenters on the website, as well as the recording. And please, we continue to do this every month for the champions. It's champions learning from champions, and BPSO or BPG leads learning from each other. So please fill out the evaluation survey in terms of how you liked this one, and then specifically any other topics you'd like to hear more about. And if you have any questions, please contact Andrea Stubbs. She is the project lead for the Champions program, and you can reach her at astubbs@rnao.ca. So thank you very much, everyone, for attending, and please have a great day and be safe.
Thanks, Grace. Thanks for having us.
You're welcome.
Thank you so much.
You're welcome.